So I started my injury from badminton, and then I got sprained ankle, and then I just got a really serious pain, and then went to hospital. I did radio frequency, did lumbar sympathetic block, IV lidocaine, but many it doesn't work also. So so I met Dr. To and then planned to do this spinal cord stimulator.
Spinal cord stimulator, actually there's a lead, there's a contact point stimulating the dorsal column of the spinal cord. That means the back part or the posterior part of the spinal cord. By stimulating the dorsal column of the spinal cord, it will block the pain signal from reaching the brain so that the patient pain sensation is much reduced. The stimulator will be implanted and the battery can last for more than 10 years. If the battery is exhausted, then we need to change the battery again. So he can actually continue to block the pain for the whole life.
So there's many restrictions, like I go out, I have to use crutches and everything. And I cannot walk too long because I will have sudden pain. I cannot work because I always had to go to hospital. So I had to resign from my current work. I cannot go back to my sports like badminton or other activities that I like. So mainly at home you cannot do much actually, because you go out you cannot walk much also.
Okay. She has complex regional pain syndrome, which is a condition that is, as the name suggests, is complex and is involving a region of her body, which is her foot in this case, and it causes her a lot of pain and a lot of other things as well, such as emotional distress, swelling of the foot, changing of the color. So all leading to a poor quality of life. So usually this is triggered by nerve damage. Invariably, there is some sort of nerve damage in the foot as a result of injury, which can be trivial or it can be severe.
For complex regional pain syndrome, there are multiple steps of management. Initially, is medical like medicine, but not always medicine is effective. Subsequently, we'll go ahead with the interventional pain procedure, and our patient have underwent multiple interventional pain procedure. When all the intervention is exhausted and the outcome is not persistent, so we go ahead with the option of spinal cord stimulation.
Complex regional pain syndrome is very much misunderstood and always misdiagnosed. So the patient with CRPS, we call it, right, may be misdiagnosed as an infection or maybe a blood clot in the leg or something that is an enigma. If it's well recognized, it is also very difficult to treat conventionally by medication and certain nerve intervention, as in the case of Miss Chloe.
So spinal cord stimulation is a technology invented more than 50 years ago. However, I think many of our Malaysians haven't have awareness regarding this technique, this medical treatment. Furthermore, this spinal cord stimulation is not only for complex regional pain syndrome, also for post-back surgery persistent pain syndrome, or previously called as the failed back surgery syndrome, and also the other neuropathic pain, any other nerve injury pain. It's also helpful for blocking the pain sensation from reaching the brain so that the patient can feel much less pain. Now that is very important. It's not something very new that everybody thinking this is experimental. No, this is more than 50 years. So it's no more experiment. It's proven effective.
Look forward to be able to drive back, go back to my normal activities, go to work, badminton, everything.
I guess I'll be more freedom rather than previously when my leg is still injured, I'm more restricted. Now since it's already recovered, I can drive, I can go back to normal life, I can work, so it's very good. I want to thank you Sunway Medical Centre, Dr. To and Dr. Lai for providing me this treatment plan called Spinal Cord Stimulation that improves my quality of life.